Hey viewers and listeners, today we will discuss about spinal muscular atrophy, which is SMA. Basically, it's a genetic or inherited neuromuscular disease that causes muscles to become weak and waste away. People with SMA lose a specific type of nerve cell in the spinal cord called motor neurons that control muscle movement. Without these motor neurons, muscles don't receive nerve signals that make muscles move. The word atrophy is a medical term that means smaller. With SMA, certain muscles become smaller and weaker due to lack of use. People with SMA are either missing part of the SMN1 gene or have a changed or mutated gene. A healthy SMN1 gene produces SMN protein. Motor neurons need this protein to survive and function properly. People with SMA don't make enough SMN protein, and so the motor neurons shrink and die. As a result, the brain can't control voluntary movements, especially motion in the head, neck, arms, and legs. Now, the symptoms of spinal muscular atrophy vary depending on the type. In general, people with SMA experience a progressive loss of muscle control, movement, and strength. Muscle loss gets worse with age. The disease tends to severely affect the muscles closest to the torso and neck. Some people with SMA never walk, sit, or stand. Others gradually lose their ability to do these actions. Now the question is that how is spinal muscular atrophy diagnosed? Some SMA symptoms resemble those resulting from neuromuscular disorders like muscular dystrophy. To find the causes of symptoms, your healthcare provider will perform a physical exam and get a medical history. First one is blood test. An enzyme and protein blood test can check for high levels of creatine kinase. Deteriorating muscles release this enzyme into the bloodstream. Number 2 is genetic test. This blood test identifies problems with the SMN1 gene. As a diagnostic tool, a genetic test is 95% effective at finding altered SMN1 gene. Some states test for SMA as part of routine newborn screenings. Number 3 is nerve conduction test. An electromyogram measures the electrical activity of nerve muscles and nerves. Number 4 is muscle biopsy. Rarely a physician may perform a muscle biopsy. This procedure involves removing a small amount of muscle tissue and sending it to a lab for examination. A biopsy can show atrophy or loss of muscle. If you are pregnant and have a family history of SMA, prenatal test can determine if your unborn baby has the disease. These tests slightly increase the risk of miscarriage or pregnancy loss. Prenatal test for SMA includes amniocentesis, chronic villus sampling. Basically, there is not cure for SMA. Treatments depend upon the type of SMA and symptoms. Many people with SMA benefit from physical and occupational therapy and assistive devices such as orthopedic braces, crutches, walkers, and wheelchairs. Please like and subscribe my channel, and see you guys in the next video.